Hi, this is an interview with Dr. Raouf Hanna, a Houston-based certified periodontist and founder of Hanna Dental Implant Center. Dr. Hanna is renowned for his expertise in dental implants, having performed thousands of procedures over his career. His practice offers cutting-edge aesthetic and dental implants services to a worldwide clientele. You can find our article about Dr. Hanna on our website, 6degrees.blog, and our Instagram page, 6 Degrees Away. Enjoy the interview.
Okay, recording in progress. Let's go.
So, could you tell us about your journey from Cairo to Houston? What challenges or pivotal moments shaped your path to becoming a leading figure in dental implantology?
Well, great question. So, the background is that I actually haven't planned to or did not envision that my journey will lead me to the US or to Houston. I was actually studying dental school in Egypt, in Cairo, and I was in my second year. And then my uncle um, got transferred for his job in oil and gas, of course, to Houston. And he invited me over of the summer in 1996, where I was a second year dental student, to visit Houston and to just spend a month here. So back then, of course, it was a very different world. We barely started to get internet. There was cell phones were not that advanced, no smartphones, no Uber, no nothing. So of course, I'm a 20-year-old coming. First 2 weeks, I went to the mall, I went to the movies, I visited some museums, and then I was like, okay, I'm bored. I don't know what else to do in this city. And then I thought, do they have a dental school? And I did some research and I found that, wow, there is a medical center and there is a dental school, and maybe I should go and visit. Took me about 2, 3 days more of research to find where it is and what and how to get an appointment and what the phone numbers are and who to meet and all that. But I finally arranged to meet, and it was very bold of me that I didn't ask to meet with the admin or the registrar or anything. I met with the department chairs, and I asked them, okay, what do you guys do accept foreign students? Can I visit? Can I do an internship? Can I spend a week in your clinic? And I got shut down by probably six or seven of them, but there was a couple that were very receptive and saw some potential there, and they said, yes, sure, come and shadow in our clinic for the next 3, 4 days. And so I shadowed in one of the clinics, and of course it was the implant and perio department, which I am now teaching at. But that how it started and how I got introduced to it. I was fascinated by it. I was still in second year, and we didn't study implants in Cairo, and they were just starting here. And but the surgery part of it, and to be able to perform oral surgery, grafting, studying regeneration of tissue, which was just starting, never heard of it before, and that we're not just like trying to fix a disease, but we're trying to grow back the tissues that were lost, and that what really attracted me to it. So fast forward 3 more years, I stayed kind of in touch with them, but there's no, like I said, to type an email take you like half an hour because you have to use a dial-up and connect to the internet and hope that no one calls you to interrupt the connection. And I finished dental school and I said, okay, um, what is the process to join your program? And they said, just fill the application and send it, which wasn't that easy. I had to fax it. That was the only way back then. I didn't trust the mail. It would take like 2 weeks to get there. And I then learned that there is only 3 spots that they accept every year, 3 residents, and there's 120 applicants. So I was like, there's no way that I will even, hear back from them. But um, about 3, 4 weeks later, I get an email, that said, you've been invited to interview. And I was very surprised. But then also, I'm in Egypt. I'm not going to like buy a plane ticket for next week and fly 18 hours to come do a half an hour interview that have like slim to none chances to get accepted. So I actually told them, thanks for the interview and but maybe you should offer this for someone that's like can attend. I don't think I can just spend that much money and time and effort to come interview. I can't do it. And that was probably a huge mistake that would have changed all my life. But that professor told me, well, I understand it's not easy to travel that far for an interview. How about we do a phone interview? And, see how now we are doing a Zoom interview, very easy, we see each other, all that. No, a phone interview meant that I had to go to a calling company and ask for an international phone line and wait for my turn and then dial the number. And I remember I was thinking how much this call is going to cost me because it was like $2 a minute. And the interview took 40 minutes. And I was like, I just wasted a fortune. And, but interview went well. I, just was candid and open and honest and just answered all the questions. And then a month later, I got a letter of acceptance that I'm one of the 3 that were accepted. And that's how it started. Now I had to tell my parents that I did that because I was just doing all this hoping, for the best, but I didn't really have plans that it will happen. Like I didn't even think that this will happen. And I had 7 months to plan a total change of my life. I got accepted in like November and school started in June. And I just had to see if I'm willing to spend 3 years of extra specialty training. International graduate fee is high, and just leaving everything behind and staying 3 years by myself or in a foreign city. And plus you hear like, what if you don't make it? What if it's too difficult? What if your previous training wasn't enough? You get those doubts. And but I went for it.
Okay. So the next question is, the full-on 5 procedure is one of your groundbreaking innovations. What inspired you to create it, and how has it changed the way patients experience dental implants?
Great. Well, I'm actually very surprised. You guys did a good homework. So this procedure actually is the idea came to me when I was actually on an airplane thinking about what can be done to improve like our current procedures. And before the full-on 5, you needed 8 to 10 implants to get a full mouth implant. So basically what we're talking about, just in simple terms, those people that either don't lost all their teeth and bone in the jaw, either due accident or disease, or just because wearing dentures for full time, or people that had teeth but they couldn't be saved due to either gum disease or bone loss or trauma or decay or drug use or immune disease. Like there's a very big list of condition that ends up with a patient losing all their teeth. And you're giving them a part of their life back, but the cost was very prohibitive because to place 8 to 10 implants, take all teeth, and do a same-day procedure, it was very expensive. So basically, the full-on 5 is a way that went to use only 5 implants instead of 10 to place full mouth restoration that's very comparable to the original and with half the cost almost, which made it very more achievable. It's still expensive. I'm not denying the cost is there, but it's very different than paying double the price. So now you're accessing thousands more of patients that needs it. If you, just to give you a background, there's about at least 40 million American that needs this procedure that cannot afford it, or that only a very small fraction can afford it. So I think that made a breakthrough, helped a lot of people that didn't know there's hope or didn't or couldn't do it before. Some people take loans and pay it over 4 to 5 years, which is a big commitment, but I've had so many people tell me after that changed their life. They never regret that investment and that decision.
Thank you. And you've developed multiple patents in implantology. What's the story behind one of these implant inventions, and how did it impact both your career and patient care?
Well, innovations in medicine or in general, whether you trademark or patent or think about a different step of a surgery or a different technique clinically, all comes from thinking and not just performing the procedure, but thinking how can you change it, how can you improve it. There are some types of, for example, one of my designs is other than the full-on 5, for example, is a design that connects the implant parts together to prevent mobility or bone loss around it in the future. All those things combined, one after the other, small step here, small step there, either affect the success of the procedure or the success rate or the affordability or the ease or the recovery. Like every step of the process matters.
Moksh, hello?
So,
Or you not? I'm not just saying hello. You need to.
yes, I understand. Wait, uh, pause the recording.
What are you saying, Moksh? Just go.
Oh, okay.
Sorry, we're having a small.
Yeah, sorry, am I lagged out? I couldn't say anything. I don't know. Your practice emphasizes an all-in-one in-house approach to care. Why was it important for you to build this model, and how do you think it changes the patient experience?
Very good question. So just to put it in perspective for people that are not aware of the process or what we're talking about, the doing a full mouth restoration or building someone's teeth back from the ground up usually required at least 3 different people. One that works in surgery, one that works on teeth, and a lab that makes it. And most of the time, and still till nowadays, that model was happening that the patient would have to go to the surgery office, get the surgery, and then either the same day get transported to the other office to get their teeth done, or go another day and stay without teeth after they recover from surgery. And both doctors will send it to a third-party lab to make the teeth. That was very, and still, I don't think this model will survive for long. We started making everything in the same place. So I'm the same person that does both procedures, and I have the lab in-house. So the patient doesn't have to go from an office to a place, or to go get their radiography or their CT scan in a radiography facility or an X-ray center. Everything is under the same roof. So we do from the beginning and the planning all the way to even cleaning the teeth and maintaining them afterwards, which even other all-in-one centers may not have. We have everything in the same place. So that makes a big difference in patient comfort, in communication between the team members, and in the outcome and the success rate.
Okay, so now that we've learned about like these developments in the models, the next question is, as you've built your career, what role has mentorship or collaboration with peers played in shaping your approach to dentistry and innovation?
Well, mentorship, like I mentioned, that question has two parts to it.
Yeah.
First, my mentors, the department chair that was world-renowned scientist that still found time to teach me or to accept me and to take me, along with all the faculty and the professors that I had along the way, whether in grad school or post-grad school or after graduating, and the continuous help and support. Plus, I turned around and I gave back by becoming a faculty member and mentoring and inviting residents and students to either shadow or to go to the grad clinic and work with them on performing surgery or giving lectures and to peers. It's, I learned both ways. I learned by being mentored and by mentoring. You always get questions that make you think, okay, well, that's a good question. Let me study more about that or read or think about it from a different perspective. You have to have an open mind.
Thank you. Innovation in dentistry is constantly evolving. How do you stay ahead of the curve, and what advancements do you believe will shape the future of dental care?
That's, we are required to take CE courses, but that doesn't mean that that's the only thing you can do or that's enough. You have to keep up with research. So there is scientific journals that you subscribe to, you have to read, you have to see. There's also specialist meetings that happens, like I'm a member of several of those organizations where you go attend their annual meeting. There's also corporate forums where companies and medical manufacturers will present you all their new research and advances, whether it's materials, whether it's instruments, techniques, um, design materials. Uh, the biggest advances that happened in the last probably 10 years is the introduction to digital dentistry, where we now have a lot of our processes, instead of being analog, are now digitized, meaning we have intraoral scanners that will scan the mouth and give you an exact replica through a 3D printer or through a milling machine. The advances in these are changing constantly, either inventing even metals that can be 3D printed, which is very new, ceramics that can be 3D printed. The cost is very high for the pioneers, but then as it gets to become more mainstream, it gets to know and to be cost effective and accurate and time. Like, to give you an example, like printers, for example, would in the past, or when they started 3D printers, some of them were like 50,000, 100,000. It will take 6 to 8 hours to print a model. Now we're going down to like 15,000, 10,000, and takes 20, 30 minutes to print. So you just have to keep up with what's going on, for sure, if you want to stay ahead.
Thank you. So, as an educator, what do you find most rewarding about teaching the next generation of periodontists? And is there a particular lesson or value you hope to leave with them?
Yes, I touched a little bit on this before. The value of teaching is, like I said, I benefit, they benefit. I'm giving back to the profession, and they're also keeping me, make sure that I'm informed, that I'm up to date, that I can also find ways to simplify complex procedures and tricks in the process and the science behind it. Like I always ask them or want them to know the why, not just the how. Because when they're on their own, they will need to know and make their own decisions during a life procedure.
Okay, like you said, there's a lot of aspects in this career that the younger people need to know, but dentistry combines science, artistry, and patient care. How do you balance these aspects, and how does your creative side play a role in your work?
That question have so much to talk about, but just to keep it like for the time's sake, um, the art you have to have the hands. Okay, you have to train your hands, and yes, you need a certain dexterity and a certain basic, but with practice and with constant learning, you can really get good with your procedures. The science is very important because if you don't know why things work or don't work, you will never learn from your failures or mistakes or understand why something worked better. Like you have to keep analyzing and thinking, what is the cell biology? What is the wound healing? What is the blood supply? What is the sequence of events that happens? What are the risk factors in a patient? What's their systemic health? Are they fit for surgery? How are you going to sedate them? How are they going to sleep? What's the procedure length? Can you do it faster? Can you do it better? And then patient care, a lot of doctors in general sometimes like focus so much on, I have the case, I have the case, I have the case, but it's also a human. And it's also someone that you need to explain to them what's wrong, what are the chances, what are the risks, what are the outcomes, what's the process, what are the steps. And most dental patients, especially the patients that have reached the end of the road and have to lose all their teeth, are completely and scared and anxious and apprehensive. And that makes them sometimes have kind of a mental block of what you're trying to explain, because all they care about, like how painful this will be, how am I going to recover, is this going to work, what is it going to look like after I'm done, am I doing and taking the right decision, I'm spending a lot of money, so you have to care with this. And I don't do this alone because there's no way I can do everything myself. I trained my team to take care of a lot of these for me. And that's a very important thing, because without a good team and a trained, cohesive team, you can't achieve those complex procedures.
All right, so you've talked a lot about the patients that you've worked with over the years. Is there a particular story or moment with a patient that stayed with you and reflects why you do what you do?
Every single case is a story. Those patients, like I said, they took years to reach me, to need me, to be in need of such a big procedure. And they had obstacles, they had a story, how it happened, why it happened, uh, what was blocking them from access to it. Either they didn't know about it, or they couldn't afford it, or they were scared or anxious or traumatized, or had other stuff in their lives that was more important to tend to. All these things make a big difference into when they finally decide, okay, I'm ready. And then comes the day of their procedure. And the nice thing about my office is that there is kind of an instant gratification, because you wake up and the new teeth are already installed and ready to use. So you went through 4 hours of surgery or something, and you go in as one person and you go out with a big difference in your life, a significant change.
Yeah.
Thank you. And we ask all of our interviewees the same two questions at the end. And those are, how do you define success? And if you could give advice to your younger self, what would that be?
My definition of success, kind of relative. I feel that I am not satisfied or happy with where I am unless I feel I've done my best and I've achieved almost my full potential. So, which is very difficult because you're not the same person you were 5 years ago. You're more capable now, you're more efficient, hopefully. And that means that you have to just keep setting the bar higher. Now, part two, or the second question of what advice to give my youngest self, not to sell the crypto I bought in 2005 is a big one. And no, no. No, I mean seriously, one of the biggest things is to trust the process and trust that hard work pays and that um, small step at a time adds to big rewarding career and life.
Thank you so much. That's all we have.